Hello, everyone. Welcome to Attorney Speak, and I'm back with another episode of this podcast. And today, we are beginning the new session of our guest series. I welcome today's guest, Dr. Nisha Rawat, who is a renowned spine consultant, spine and rehabilitation consultant. Welcome, Nisha, to our podcast, Attorney Speak. How are you?
Thank you so much. I'm doing great, Manisha.
I hope this podcast is going to be an interesting one because your insights could be valuable, for this entire session.
Yes, I'm looking ahead for the same.
So I'm going to, initiate the questions. My first question would be, what kind of issues, the spinal issues or rehabilitation issues in general, ergonomic issues, we see at workplaces, like the common workplaces, our office ends, etc.
At the offices, the common ergonomic issue is related to basically the two aspects. One is the workstation, that the
Okay,
workstations are not ergonomically correct, and the another
absolutely.
aspect is our posture. So whether we are sitting in the right posture or not, are we leaning too much forward? Be it any like if it is a sitting job, then if you're leaning too much forward, and if your height of your table and height of the your chair is not appropriate, then you could get into a lot of spine issues. In the similar manner, if you are in into any
Okay,
profession in which long hours of standing is needed, in that way, due to the poor, poor shoes or due to the poor standing gait, you can again land up in the same issues. So,
okay.
different workstations, different work profile can have different ergonomics, the correct ergonomics that can save your spine.
Okay, can we basically design the workstations? I mean, what are the techniques and how can we implement workstations which are basically adapted for, perfect ergonomic usage and which can make the employee stand, the stress of the work? Can we develop these kind of workstations or are they actually into practice in offices?
So these workstation need to be planned accordingly, according to the type of work in which you are involved. So, like I said, if it is sitting, standing, or if your works require long-term walking, then accordingly the workstations need to be modified ergonomically. Like, for example, if
Generally,
you are
generally, I'm
in
talking
general,
very
in general,
specifically.
in general, your posture, the ergonomically correct posture should be the one in which your normal curves of the spine are maintained. So, if I'll speak in a layman term, then you should try not to bend too much forward. So, if you are sitting on a chair, then try not to lean forward. Try to keep objects close to you. If you are
Okay,
keeping your laptop, you are keeping your phone even
yes.
very far away from you, then you have to bend forward to pick those objects or to work on the laptop. So that one thing can be done. Your keyboard should always be close to your body. Your arms should be maintaining the 90-90 degree position. So one
Okay.
simple tip is everything close to your body. It should not be too much far away
So this
so
is
that it
meant to
doesn't
be
cause
for the
stress
people
on
who
your
are
joints.
basically doing the desk jobs. Is that so? The people who are doing the desk
This
jobs,
is for the
these
desk job.
modifications can be possible.
See, this modification can be possible for the desk job if you are involved in a standing job like a teacher. So if the teacher is there, then she has to mind that the height of the blackboard in which she is writing, it should not be, it should not be level too
Okay.
high. So it should be level to near her shoulder so that she needs not to raise her hand too much. So like I
Absolutely.
said, that the workstation needs to be made adaptive. We can't have a fixed ergonomic for
Okay.
all the work profile. So it has to be catered to different work profile.
Okay, that means customized to different work profiles. Okay.
Yes.
Okay. I wanted to also know that what kind of, rehabilitation issues you have witnessed during your tenure as a spine consultant in most of the workplaces, of today's times.
Like the national survey, which was recently being done, it showcased that majority of the pain which is there in the work-related areas or the
Okay.
work-related population is the neck and the back pain,
Yeah.
neck and back pain, and the leg pains. So 70 to the 80% of the working population is suffering from these pains due to the poor ergonomic. And apart from that, apart from this
Okay.
survey, you could see a lot of anxiety issues because of the poor posture and poor sitting arrangement. People could have anxiety attacks, they could have breathing issues also,
Yes.
and chest pain also because of the poor ergonomics.
In fact, I was about to going to, my next question was immediately, this one only, that, does stress and anxiety also play an important role, or does it, depend on some kind of ergonomic position you're at during your workplace, or are they, like
Yes,
correlated?
no, no, yes, absolutely, absolutely. Your stress and anxiety could have a lot of reasons, but one of the, like, when we are just focusing on the ergonomics part, then how a poor ergonomics can cause anxiety and breathing difficulties and stress, that is related to because our lungs are located in front of our chest, right?
Okay.
And when we are sitting for a very long time, our abdomen gets pressed, and when we are leaning forward, like even if we are on the mobile or on the laptop
Most
and
of the
we are
time.
leaning
Yeah.
forward, so we are compressing our chest and we are pressing our abdomen as well. Due to this, we are compressing our lungs also, so we are not able to take long breath, and this happens like unconsciously.
Hmm.
You are not always aware of your breath. So unconsciously, you are taking short breath, and when this happens over the course of time, you develop the habit of breathing at, shallow breathing.
Shallow
You develop
breathing.
this
Yes.
shallow breathing pattern, and because of the tightness of the muscles in the front portion of your chest, you develop anxiety also.
Okay. So
So
this
these
is
are the basically the
related.
main reasons.
Okay, because I also
Yes,
find, for
absolutely.
example, as a patent attorney, and people who are basically into very high detailed oriented jobs like ours, which involves a lot of sitting in front of your monitor screens or your tablets, etc. We do actually end up having stress related issues, and sometimes your posture. Many a times, I think the posture might be contributing to it.
It's the posture also, and then it's just like a cycle. It's just like a chain reaction. One thing is connected to the another. So poor workstation, poor workplace modification leads to poor body posture. Poor body posture leads to poor breathing pattern. And over the course of time, this poor breathing pattern and poor posture contributes to the stress because we are breathing less. And normally also the work profile is also like that. When you're too
Yeah.
much stressed,
Yes.
no, you must have seen that we tend to hold our breath, and that
Yes.
tendency of holding our breath is very common. It all happens unconsciously, and this with the poor posture, with the poor ergonomic workstation, it all contributes and exaggerate the normal blood pressure also, and exaggerate the anxiety pattern as well.
I also wanted to ask you, like you have spoken about, customization of the workstation, but do you think that most of the workplaces have these kind of customizations, or the employees, themselves, can cater to such kind of small customizations at their workplace at their own end?
I think it needs to be done at your end only. You can't depend upon the management on the HR to provide
Yes,
you that.
yes, that's
Maybe
right.
in the high-rise corporate sector, probably they could take care of that. But when it comes to work, we need to look at all the types of work. So I
Can you
think it
give
is
us
your
some
own
examples,
individual
like
responsibility.
some quick examples? For
Like if
example,
you're
a
sitting on a
computer
chair,
specialist.
like if there's a computer specialist and you're sitting on a chair, and what you need to do, you just take a roll of a towel and place it on your back and lean on that
Okay,
over the chair.
okay,
So
okay.
that is one way of just arching your back, because when you arch your back passively with that towel, with the help of that towel
Yes,
roll,
yes,
it maintains the curve of your back, that relieves the stress on your lower back. So this is one way. Another way is that you should take a short breaks, that you should not be sitting or
yes,
standing idle in one posture for long duration of time.
yes,
Like if you're involved in a sitting job, then after every 20 minutes or half an hour, you should get up and, start doing some activities, take a walk, come back,
yes.
take a round, pick up a glass of water, and then come back on your seat. So these small things really helps.
And
And there are
I
a few
also
quick
wanted to ask
touches.
you, because we are talking about the techies. So the increased amount of screen time can also basically cause the postural issues. However, this is not directly related.
See, it is that when most of the time when we are, we are sitting and the screen time is more. So during that time, our head is normally in the forward position
Yes, yes,
most of the
that's
time,
right.
and there's a lot of strain on our eyes also, and the muscles around the head, on the back of the head, are coming forward and are connected to your eyes muscle as well. And so if the screen time is more, then it can definitely have effect on it can exaggerate your neck pain, and it can contribute to your neck pain also and your eye pain also, because your eye muscles are somewhere connected to your upper head muscles as well. So it can have a vice versa effect because of, being the strain on the muscles, and also because of the poor neck posture, because most of the time
Yes,
being on screen, you are forward head,
yes.
which is not a very good posture.
And I also wanted to discuss something about work from home format. Do you think it is more comfortable for you to basically, use these customizations at, home rather than, the actual workplace? I mean, how do you view these things? Is it easier to basically,
I think again it depends. I think again it depends. The reason being because it depends upon you, how well aware you are, and how well disciplined you are in these matters. Because this is what I have seen in my clinical practice. Those who are doing work from home,
okay,
they are also, subjected to the same poor posture. And I think at home, you are vulnerable for more bad posture,
oh,
because we got patients like they're lying on the bed, and, and
yeah,
they're sitting on
I do
the
most of the time.
couches and
Yes,
in the bad posture.
yes, I can understand.
So this is what they do most of the time because no one is looking at them. So I think, it's not about that work from home can give you a better option. I think it first need a person who is, aware and dedicated enough to take care of his or her posture. So be it the workplace or be it home, it entirely depends upon
Yes,
you.
that's
So
the
I
habit.
think if you go to a well-known spine physiotherapist, they can tell you variety of techniques which doesn't require a lot of effort. It won't take much time of yours.
Mm.
But again, it needs to be done because they see 9 hours, 10 hours, 11 hours you are sitting on the chair or doing your work. Those few adjustments are needed, and but they need to be done at the consistent pace. You can't do it at one day and then you leave it the another day.
And do you recommend any kind of nutrition? I'm sure that most of us are not taking care of our nutrition, and the nutrition can also play an important role in, ergonomic posture maintenance. Is there any
See, it is
correlation?
that whenever absolutely it plays an important role. The reason being, your posture is concerned with your muscles and bones, right? So,
Yeah.
a poor muscle nutrition and poor bone nutrition obviously makes you more susceptible for these pains. So, like lack of vitamin D or lack of protein, lack of vitamin B12, because most of the time we are inside, like so
Not in the
90% of the
sunlight. Yes,
population.
most of the Indian officers. Yes.
So yes, 90% of the population is deficient in vitamin D because of not being exposed to sun. And vegetarians are prone for vitamin B12 deficiency as well. And most of the people are basically being on the fast food. They missed on the essential nutrients like proteins and certain vitamins. So yes, of course, the nutrition have direct impact on your muscles and bones integrity, and yes, definitely it affects the outcome of your poor ergonomic also.
I think we have covered most of the topics, and this discussion has been quite an informative one. I hope that we can bring you back, in another episode of the guest series where we can basically learn about the practical exercises. Those could be done at workplace and work from
Yes,
home
sure. Yes,
format.
sure. We can.
I'll be happy to
Yes, yes,
collaborate with
because
you back
whenever
again, because this is basically a very in-depth area of discussion, and it cannot be wrapped up in a podcast, in just a matter of few seconds. So I hope that I will catch you soon. But any other, ending notes before we sign off?
Yes, sure, Manisha. This is a detailed topic, and I think without any practical, this podcast will not only serve the purpose. A practical application is very much important, but just few tips which I would like to give, which one can follow. I think even a small thing, if you follow for the consistent period of time in a disciplined manner, can have a significant impact on your life. So, like the quick tips involve, very first tip is that walk. Walk means walk
Walking,
in the
yes.
sense that if you are, see, it depends. If you are in a sitting work profile, then after every half an hour you should take a break,
Okay,
get up, stand at your
yes.
workstation, or roam around. Second thing, and if you are involved in a standing profession in which long hours of standing are needed, it is very much recommended that after every half an hour you should have a chair beside you
Hmm.
and you should take sit and
Hmm.
take a break. Second tip is deep breathing. Second tip is that you should never hold your breath. Consciously be aware of your breathing. That every 15 seconds you should be taking two long deep breaths, raising your tummy up. So these two are very important. Third is that always get yourself checked for the vitamin D and vitamin B12, and always involve protein in your diet. So I think these are quick tips which can be involved.
Thank you, Dr. Nisha Rawat. I think we have asked most of the questions, but yes, a lot of things are remaining, and we will definitely call you with your permission on the next episode where we can be more elaborative in terms of techniques and exercises that we could employ. I would also leave, your email address for people to basically, who need consultations for workplace related issues like this. And I'm so happy to connect with you, and I will be happy to connect with you in the further episodes also. Thank you very much for being our guest.
Thank you. Thank you.
Thank you.
Thank
Yes.
you.
So, guys, this was your episode on workplace rehabilitation techniques and nitty gritties. I hope you like this episode, and in the upcoming guest series, we are going to bring more and more guests from different walks of life, professions of life, and I am definitely hopeful that you would definitely find all the episodes very interesting and very practical. Thank you very much. Stay tuned.